Thank you very much. Good afternoon, everyone. It's an absolute pleasure to be here presenting to you. As already mentioned, my name is Mehru-Nisa Shah. I am Haref's Senior Development and Haref Allies Officer based at Connected Voice. I'll quickly go over the services offered at Connected Voice because previously in the meeting, our corporate volunteering opportunities popped up. So Connected Voice is an infrastructure organisation which supports VCSE and grassroots organisations in Newcastle and Gateshead. Our support and development team helps smaller organisations with the likes of training, policies and procedures, and governance. We have a business service that offers support with accounting and independent examinations. Also, an award-winning advocacy team that supports individuals experiencing problems with things such as hate crime and who may need a little more support around neurodiversity or safeguarding. We also have various volunteering projects for individuals and also corporate volunteering, which links corporations and businesses to the VCSE for skills matched volunteering for identified need within the voluntary sector. Today, I will be presenting to you about the work of Haref, formerly known as the Health and Race Equality Forum, whose aim is for health equity for ethnically marginalised communities in Newcastle and Gateshead. We have been in operation for over 20 years now. Our work primarily focuses on improving access to health services for those communities and providing health information in a relevant format for our diverse communities. Next slide, please. At Haref, we amplify the voices of our communities and their health priorities through our Haref network, which is made up of around 100 community groups and organisations representing or working with ethnically marginalised communities in Newcastle and Gateshead. We give our network a platform to speak directly to our Haref Allies. The Haref Allies are health and wellbeing practitioners and services. We work with our Haref Allies to improve their understanding and confidence to work with diverse communities, supported by our cultural competency training. We also share good practice and information through our Haref e-bulletin, at which point I'll stop and say, if you aren't already signed up, please do sign up to our Haref bulletin. We're also involved in health research, either as PPIE leads in research projects or leading on the delivery of research with our communities as key stakeholders. Our work stream follows a holistic model and each area supports one another. The overall aims of Haref are to support the communities to identify key issues around health and improve the health information available. Also to build confidence within communities to talk with health services about their cultural needs and to help health services have a better understanding of what our communities need. Next slide, please. We will go through our work streams with you now, starting with the most important one, which is, of course, our Haref network, which is at the heart of all we do. In it, we have over 100 groups and organisations who are a community or voluntary organisation led by people from ethnically marginalised communities or an organisation with a targeted project for ethnically marginalised groups. With this network, we run regular network meetings throughout the year. We connect network members to health service organisations, undertake research and involve the network in research and create resources. We gather information on current health inequities and take this information forward. We provide health information and improve how information gets out to communities. We link this engagement with health services who want to encourage ethnically marginalised communities to uptake their services. We ask communities what is wrong with services and what they could be doing better to be more accessible. We also lobby and campaign with health services, the ICB, and public health teams for service change. We often get a lot of requests from health providers to work with different communities and to let people know about different health services all the time. But engagement needs to be a two-way process and not just telling communities about services. Next slide, please. Another work stream is, of course, our wonderful Haref Allies. As I've already mentioned, this network is run by myself. I helped develop and launch the network over 4 years ago. Through our Haref Allies, we aim to improve health and wellbeing services that are provided for our ethnically marginalised communities. To be an ally, there is, of course, criteria. Your organisation must provide health and wellbeing services or have social value or address the wider social determinants of health, or fund voluntary community and social enterprise organisations. And finally, deliver some of your work in Newcastle and Gateshead. This is a low cost, paid for membership, and we currently have over 100 organisations and individuals signed up. Our aim for membership is that services will be provided with help and guidance on how to improve health and well-being with our ethnically marginalised communities. We run 4 events every year with our allies. We also like to provide and facilitate opportunities to work in collaboration with our Haref network, such as our health and wellbeing information sessions, where we arrange sessions based on issues that communities have told us are important to them. We also share information and good practice at our events and through our bulletins. We provide training opportunities to support individuals and organisations to be culturally competent. In recent years, we have seen an increase in the number of research-based Haref Allies join us, which is absolutely fantastic. And we're actively delivering information sessions on health topics with opportunities to go on and be involved in research. The next one that's actually happening is being delivered by our Age Research Allies in January of 2026 with Rabda, Muslim Women's Group, based in the West End of Newcastle, and we're already looking forward to that one. We hold skills building sessions. We held one in 2024. This particular session was focused on research at the request of our allies. They wanted to know what health and wellbeing research is, what it consists of, and how to go about gathering information effectively. We were joined by our allies from NIHR and VON, who presented on the importance of inclusion of ethnically marginalised communities in research and shared their fantastic NIHR community engagement toolkit. We worked together as a group to feedback on the toolkit, which proved to be very useful. We have also held 2 of what we call our good practice guidelines skills building sessions, again, at the request of our allies. The latest one was held a couple of weeks ago, I do believe on the 19th of November, very well received and very well attended. We understand the importance of participation, and this is something we always champion. We know that ethnically marginalised communities are starkly underrepresented in the area of health and wellbeing research. At Haref, we're looking to address this and have plans to expand with a possible research role within our department. Watch this space. If you'd like to be involved in the Haref Allies membership, feel free to reach out to me. I'm happy to be of assistance. At the end of my presentation, I will pop my email address into the chat. Next slide, please. We deliver cultural competency training to frontline health and wellbeing staff. This introductory course looks at the barriers to accessing services, explores culture, looks at local demographics, and gives guidance to help provide more inclusive services. Our cultural competency training is aimed at improving practitioners' confidence in working with different communities. It uses feedback from the network to shape it. We use videos from network members about their experiences in health and using services, highlighting what went right and what went wrong. This makes the training unique as it is built using local intelligence and real life experience. Practitioners are sometimes not aware of the specific barriers that are experienced, and the commissioned videos enable better understanding of the impact of health inequalities. The training is funded by Newcastle City Council Public Health and is free for practitioners delivering services in Newcastle only. We can, of course, deliver the training as a paid for premium service outside of Newcastle. As well as cultural competency training, we offer an introduction to health inequalities as a premium paid for service. This training is for practitioners, service providers, researchers who want to gain a broader understanding of health inequalities, looking to understand how health inequalities impact a range of communities, both locally and nationally. Further details can be found on our website. Next slide, please. All of this wonderful work is, of course, supported by our Haref e-bulletin, which is a monthly bulletin with a focus on health and race equity. And it covers what's happening locally in Newcastle and Gateshead with regional and national updates. I myself lead on our e-bulletin. And as I've already mentioned, if you haven't signed up, you are missing out. In the bulletin, we promote funding opportunities, events, information for practitioners and local people. It features updates from the North East North Cumbria Integrated Care System, as well as a dedicated section for research opportunities, consultation, and reports. We coordinate updates from our Haref network and Haref Allies for the bulletin. We've reached over 1,000 signups, ensuring that the information reaches the right people who need it. Next slide, please. And that leads us, I'd say, quite nicely into why diversity is so important. Why diversity is so important in public involvement in health research. Put simply, it's because health inequalities exist. Health inequalities are, of course, avoidable. Unfair and systemic differences in health between different groups of people across a population. They do not arise by chance and are caused by social and economic inequalities in society. Some people find it much harder to have good health outcomes because of where they live, who they are, their life experiences, and their access to services. And this means that health inequalities have a disproportionate impact on different groups and populations, be that due to their protected characteristics or for socially excluded groups. We therefore need to address this with targeted health interventions for population health. We need effective health research because health inequalities exist and unfortunately are getting worse. I think it's fair to say we are facing a very real health crisis in this country. So to carry out health research well, we need to put public involvement at the heart of research, which will ensure everybody mutually benefits. And this is why diversity is so, so important in PPIE in health research. We need to think and be mindful about how we engage with and include older people, asylum seekers and refugees, people with disabilities, ethnically marginalized communities, LGBTQI plus community members, those from socially excluded groups and inclusion health groups. It will be these groups and communities who are most adversely affected by health inequalities and have the worst health outcomes, but also less likely to have the opportunities to engage in research, to access health services, or to have the support to make changes in health choices. Interventions and engagement with health research and opportunities need to be as accessible and representative of our population as possible. Different groups respond in different interventions in different ways. And so we need to study all groups to get the right balance of risk and benefit. This, of course, improves the relevance and quality of the research, with it focused more on outcomes that are important to the public. It also benefits the individual. Public partners bring their expertise in the form of their lived experiences and can bring their opinions on what is important and whether our ideas will work. Next slide, please. Haref work with researchers in a number of different ways. We like to be versatile and accommodating. Haref have led on research projects with community partners at the heart of them, such as a piece called Health Inequalities in the Age of COVID. We can also act as the public involvement leads and link to community groups in projects led by universities. We always ask all researchers to become a Haref Ally, and the individuals that participate in research are paid appropriately for their time and to cover the likes of venue and interpreter costs, which should always be included in research study costings. Haref staff also sit on the Health Determinants Research Collaboration Advisory Group to ensure the voice and needs of marginalised communities are part of their work. Today, I want to share details of one of our research projects, which was called Health Inequalities in the Age of COVID-19. This project was delivered in partnership with Newcastle University, Riverside Community Health Project, and the Inner West Primary Care Network. Haref were the project leads. The research looked at how health messages in the pandemic were acted on, with the aim of identifying effective ways to get information they need in the future. As part of the research, we looked at how people understood and interpreted messages about the COVID pandemic. We supported people to identify effective ways to get the correct health information that they needed, and we responded to this as and when it was needed. This was really important during this stage of the pandemic. We also liaised with primary care providers and commissioners throughout to identify ways of translating findings into action. Next slide, please. We changed our methodology due to COVID and took the decision to work directly with 11 community partners to help deliver the research. We could do this because of the levels of trust that Haref and Riverside have with local people and how we are able to support them to have a voice. We had to do this all online. The community partners represented different community groups who lived and worked within the communities they undertook research with. We took the time to train our community partners so they could shape the research and questions. In the end, we agreed on 9 questions for our partners to ask people in their groups. They chose the questions that worked for them and were important to them about health messaging. Each community group decided how they would ask these, when and where would be the best time to have these conversations. We let them use their own expertise on what would work best with the people in their communities. And what did this mean? It meant we got excellent engagement from people as we let them decide what was best for them. They know themselves best. This work did take time, and each community partner needed support to carry out the work. We had multiple meetings, offered technical support, such as facilitating meetings or one-to-one conversations outside of the team meetings. We also made sure we paid our community partners for their time and their attendance at our meetings and for running the group work. The partners then went on to help us look at data for themes, helped finalise the report and shaped the recommendations. Our community partners were asked to define what the role meant to them. And one of the definitions that was given to us that I'll share, a community partner acts as a connector to connect cultures, communities, and serves as an important role to bridge communication and knowledge between communities and institutions that want to be engaged with communities. Next slide, please. For us at Haref and me personally, one of the most important parts of any research is what happens as a result of the research. Haref did not stop this work when the funding and the research ended. We have continued to work with community groups and health providers. We facilitate health and wellbeing information sessions on issues such as mental health, navigating the NHS, eating well, health checks with community groups and services, and pharmacy students. This helps to develop better links between health providers and our community groups and to build trust between them, and also get service to think about what they need to do differently. We respond to our communities in the Haref network, asking them what are their key health concerns at the moment. We share our community intelligence on health concerns and the needs for ethnically marginalised communities with our key stakeholders and health services, so that they can look at what they can deliver and where to focus their reserves. Haref and the research team were awarded the Dialogue for Change Award for the way local people were listened to in the development and delivery of this research. Next slide, please. Finally, I just wanted to highlight other pieces of work that we're involved with while I've got this opportunity. As already mentioned, the good practice guideline session delivered to our allies. This was a piece of work co-produced. These guidelines were co-produced with us, with the Comfrey Project and HealthWorks. Our health and wellbeing sessions are a collaboration between our Haref network and Haref Allies, focusing on topics and health issues which are important for people. And we aim to support informative and accessible sessions. An example of a session: one of our Haref network members, the Hindu Temple Newcastle, approached us for some support and information around dementia and Alzheimer's following a group member's experience with a family member, and acknowledgement within the group that some members of the community were struggling with symptoms of these conditions. Haref linked the Hindu Temple up with one of our fantastic Haref allies, who is a researcher who specializes in dementia and brain health. We ran 2 sessions about looking after your memory for males and females. As a result, group members showed interest in participating in research. Other examples of our work: the Ramadan prayer calendars with safe fasting messages, which is actually happening right now as Ramadan commences second week of February. The idea for the prayer calendars came from one of our local imams over 15 years ago. And each year we work with them to develop and distribute the calendars to our local Muslim communities. Alongside the prayer times, the calendars contain safe fasting information, tips on managing diabetes and managing your glaucoma. This important health advice is created in partnership with NHS Diabetes Centre, Glaucoma UK and Diabetes UK. We've also produced a Rights to an Interpreter in Health Settings leaflet. We've regularly heard over the years, again and again, that both patients and practitioners are not fully aware of their rights to a spoken word interpreter and how to access one when needed, or not knowing what to do if there is an issue with a provided interpreter. We have heard from both patients and different services that there are ongoing issues with accessing interpreters. Working in partnership with Newcastle upon Tyne Hospital Foundation, we collected information how to help people know where and when to ask for an interpreter when accessing different health services. This included in primary care and secondary care settings, how to seek support and how to complain if a spoken word interpreter is not provided. We've also contributed to ICB consultations, such as their urgent treatment centre review in Newcastle, by running focus groups with our network to ensure that their voices are heard and that they feed into health service changes. Next slide, please. I'm just going to stop for a second and to give you a moment to have a look at the 2 quotes on the slide. Top one reads, "The Haref network members who got involved in the research were as important as the rest of the team. Haref made the research have a very inclusive feel." The second quote, "Being involved in the research gave a lot of confidence to people in our community. They never thought they could do something like that. Haref made that possible. They gave us belief that we can engage in research." Next slide, please. Finally, I thought you might be interested in some of the other research projects that Haref have been involved in the last 5 years. So as you can see, there's a good mix of different kind of subject areas and topics. And of course, involvement of our marginalized communities is important in all of these areas of work. Next slide, please. And I think that is me done. So over to you. Any questions?